So we have to think about every day what's the best use of a resource. And that's about new roles, okay, not just sitting in our boundaries, trying to think, what can we blur the boundaries a bit? Is there something you can do to help me and I can do to help you? If the district nurse is coming in, could she do something for the community mater instead of both of them coming in? If the district nurse from that practice, because it still happens over in the east side, so you can have a care home that's got 5 different GP practices that go in. You can have 5 different district nurses going in because they all belong to a different GP practice. Why can't you just get your heads together and say, do you know what? I'll do that care home and I'll do it all that day. And you do that care home and then do all that. It's not beyond the wit of man to think about a better way of using the resource that we've got. Reducing waste. And we all waste. I think about it every day when I'm scrumping another bit of paper up that I've written a couple of notes on when I'm on the telephone and I'm putting it in the bin, thinking I really should have done something other than that. It's really bad that I'm doing that, but we keep on doing it. And we do waste a lot of money in the health service because we don't think on a daily basis about who's paying. We're paying. So the bottom line is we're paying, but there's a bit of a disconnect between us at the front end. It's everybody's responsibility to think about the resource that we're using. In a care home, let's be honest, people wouldn't be doing it if they didn't need a profit. It is, whoever owns that care home is in it for the business. Yes, they're providing really good care and, they've got all these sorts of moral values about what they do, and absolutely right and commendable. But the bottom line is, if it doesn't make a profit, then the home closes, and we've seen that lots and lots of times. So we all need to work together to make the best use of the resource we have. Reducing variability. If I look at something like continuing healthcare, it might surprise you to know that if you move to Northumberland, you're more likely to get continuing healthcare, so full funding, than if you move to Durham. Okay? Massively different. So in Northumberland and South Tyneside, 50% of the people who ask for it get CHC funding, are deemed eligible. If you go to Durham, that's 14%. Why? Because actually it's a percentage, it's based on the population. Those percentages should be about right. There's a national percentage of around about 25%. So anything much lower, anything much higher, you wouldn't expect. So what's going on there? That's not the best use. That's not reducing variability. We need to look at those and think, what are people not doing, or what are people doing that makes the difference? Economies of scale. That's what these new ACOs are about. So these accountable care organisations. It's about having a pot of money. So imagine in your area, if the CCG money and the acute trust money and your community care providers money was all put in a big pot together, and then they all sat round a table and said, okay, we're looking at the people in North Cumbria, what are the needs, what do we need to provide, and there's this massive pot of money, and we're going to sit together, those 3 organisations, and work it out for the best. We're not going to say that this is my pot of money and I'm only providing this bit, and this is my pot of money and I'm providing this bit. We're going to get together and put it all in the middle, and then we're going to have economies of scale because we'll be able to commission bigger, and the more you commission, the cheaper you can get it. That's the common sense. I'm not necessarily extolling the virtues of ACOs, but what I'm saying is, if people work together, there are much better ways of doing things which will release efficiencies in the long term. That's inarguable. Being proven not just in healthcare, being proven in business, finance, it can work. And this, I've got this in inverted commas because Ken constantly says to me, every time I'm paid, best doesn't equal most expensive, Sharon. So when I say to him, I know, but I go to Marks and Spencer's because they have the best chicken. He says, Sharon, chicken's chicken. I'll do chicken's the same as Marks and Spencer's chicken. But I don't work like that, so I thought I would try and demonstrate an initiative that they're going to talk about in the future, that Leslie's kind of going to talk about, is the red bag skin, or the transfer bags. We call them red bags. That be the Gateshead use black bags, but the same premise. I got all excited when they told me at first that I had some money, they said to us, you've got £10,000 to find some red bags. Honest to God. I got really excited because I was thinking to myself, Ken's laughing because he knows I've got a penchant for handbags. Can it be a Vivian? Because I like a bit of Viv. Chanel. I mean, you've arrived, haven't you, if you've got a Chanel bag. I aspire to a Chanel bag. I've got a Vivian bag. I haven't got a Chanel bag. Thank you. Or a Louis Vuitton. Oh, I mean, just look at that. I'm leaving them up there for the ladies in the room. Just look at them. Anyway, off we went, and I was sent a picture of the red bag I could choose. It's embarrassing, isn't it? But you know, he's right. Not all best is expensive, because trying to get your medication in that Chanel bag with your discharge letters and your pyjamas if you can, not going to happen. But you know what? The red bag is fit for purpose. They'll talk to you about what its purpose is, and if we all in this room in our care homes adopted this, it's been proven to make a difference to the patient journey. And the next thing is image. And I thought I'd have a bit of a test. Those sitting in the room, there's people laughing already. When you think about nursing in the media, and I once did an essay on this when I was doing my nurse training, and I absolutely loved it. This is right up my street. Think about the image of nursing, the image that you see on the television. Tell me who these people are, and I'll be able to tell you age by who you recognise. So who's this? Nurse Ratched. One Flew Over the Cuckoo's Nest, mental health nurse, cruel. Yeah. Uncaring, vindictive. Got it? Not really a good portrayal of nursing, is it? Nurse Hughes, the district nurse. Nurse with a hat, with a lovely white apron. Have you seen that lovely white? She was getting on a bike with that white apron. Infection control was never considered. She lived in the Dales. She was ploughing through horse muck, and then she'd go into somebody's house. Again, not probably the best portrayal of nursing that we've had in the media. Karen, patients absolutely loved her. But every time I see on a nurse on a bike, I think about this. And I don't know if anybody in the room's seen there's a new YouTube video, I think you call them, whatever they put on YouTube, of a practice nurse who was trying to extol the virtues of practice nursing as a career. And she did a video, a day in the life of, to put on YouTube so you can have a look. And she's got a bike. She lost me at the bike. In fact, I watched that video, and the only bit I agreed with was when she went in the pub at the end of the day for the glass of wine. Anybody get this? If you haven't watched this, honestly, you've never lived. Nurse Jackie, get on whatever it is, the box thing that fits your telly, and look for Nurse Jackie. Brilliant. Cutting edge, advanced nurse practitioner, works in the emergency department in a busy city, New York Central A&E department. But she's got a drug problem. She's been sleeping around, found in a gutter, drunk, stealing to fund her drug habit, having affairs, sleeping with people, the pharmacist so that you get her prescription drugs. I mean, not the sort of image you want of nursing. Now, when I went into nursing, I've cut that off, but her dress was up here. The hat was on the top of her head, big hair, and your cape strapped around with your red. I had one of those. When I went into nursing, that was all I wanted, was a hat and a cape. I loved that. It was just, because you got a cape if you lived in the nurses' homes. That's the only people that got a cape. I loved that cape. But you don't really want that image of the blonde bombshell, do we? Sexy little empty-headed, numpty little woman. I'm saying that because I was never looking like that. So actually, when you think about the media portrayal of nursing, they never take the hugely professional, caring, dedicated person that most of you sitting in the room are. That's not really reflected in the media, and we've got an issue with that because actually, unless we start letting people know what the job is, we're not going to attract these new people and the workforce problems are not going to go away. But we also have an issue when our care sectors are represented. And you'll have seen too much of this, because this is front page news. Never front page news the amount of time you spend nursing somebody in the last days of their life so that have a peaceful and dignified death, and all of the work you do with the family to make sure they feel included and involved. Just the fact when it goes wrong and the reflection that has on us as carers and nurses. Always hits front page news. And you know what? It's not new. Who can remember this? 1993, Beverley Allett. Gone on. It probably happened, time immemorial. Cleverer at catching it now. But actually, before Beverley in this country, we hadn't really heard of it. It seems to be more prevalent. I'm sure it's not. Just we hear about it now. But all of us suffer because of this. Care homes took a battering after Winterbourne. You know, everybody, transforming care agenda, getting everybody out of long stay was as a direct consequence of Winterbourne. And now the move is that everybody should live independently supported living in the community because every care home is bad, and that's not true. The minority of care homes have a problem. And actually, it's not the care home that has a problem, it's the staff they employ. So a minority of staff have an issue and need to be dealt with severely. So what the Chief Nursing Officer said was that the way the nursing profession is seen and portrayed in the media and popular culture affects how we feel as individuals and as a collective. It affects how the public and other professions see us. It matters what we see on the television. It has an influence on how successful we are at attracting the best into this caring profession, retaining the best and being the best we can be at the top of our game. And in a survey with the general public, 93% of the population trust nurses and carers. So our standing as a profession, as a job, as a role, should reflect this massive level of public support, okay? We are in a unique and privileged position, and it's up to every one of us in this room to make sure that we behave appropriately in and out of work. Because if you behave badly out of work, that reflects on me. Now, I'm not saying you can't go into Penrith on a Saturday night and you can't have a few drinks and let your hair down. But neither do we want to see you brawling in the street, because it matters. So the NHS England are developing a national recruitment campaign. As I've just said, we all have a duty in this room to portray our caring profession in a positive way. And this is important to me, and I make absolutely no excuses for saying it. How you look and how you behave is important. So when you get up in the morning and you're going to work, just remember how you look makes a difference to how people will behave towards you. To be in the caring profession, you've got to be clean, you've got to be neat, you've got to be tidy, you've got to be presentable. You've got to present yourself as a professional. And you also, and this is my husband, that he used to say from our kids from being little, you promote what you permit. If you allow something to happen, then you might as well be promoting it. You might as well be saying it's the thing that should happen. Because we all have a duty to stop bad things happening. So if you see bad behaviour from your colleagues, challenge it. But more importantly, if you see poor practice, if you see somebody doing something with somebody you're caring for that is less than kind, less than professional, and less than as it should be, then you really have a duty to do something about it. Not join in, not smile and walk away, stop it in its tracks. We don't want those people working in our profession. So what are the challenges for care homes? And I can feel eyes, I'm going over. The challenges are we need you. We need every one of you. There's not enough of you. If you can all have babies and bring them in the caring profession, that would be really good. We need more people like you because you're here today. You chose to come here today. So you obviously think you have something to learn or you need to be involved when great things like this are happening. We need you. Because a growing elderly population, which we've already talked about, is more long-term conditions. Because the older you get, the more long-term conditions you get. But the more complex needs you've got, the more care needs you have. And the more care needs you have, the more care provision you have or will require. And more care provision means more staff. And we need to have better use of our resources. And we need to improve the perception and portrayal of care work as a profession. And the Enhancing Health and Care Homes framework, can I just take a quick round robin? Who's heard of this? Right. If you haven't, go back to your care home or wherever you're at and ask them to pull it up, because actually this is our strategy for care homes. It was produced in September 16 and in March 15 it was preceded by NHS England announced 29 model vanguards, and there were 6 related to care homes. And that was them. We had Gateshead, of which Leslie is the vanguard, so she'll be able to tell you all about that later on the agenda. Evenly distributed throughout the country. And what resulted was that realised that people who were living in care homes were held back by care barriers, financial barriers and organisational barriers. The care barriers were that there was a narrow focus on medical rather than holistic needs. So it was about treating conditions rather than treating the whole person. Lack of integrated care planning. So the care home did their bit, the hospitals did their bit, domiciliary care did their bit, but it was never quite joined up. And nobody concentrated on prevention. It was like once you were elderly, you were in a care home, the prevention agenda didn't matter because you were elderly. There was variable access for care home residents to NHS services. Big belief that if you're a nursing home, then you shouldn't access district nursing services. That's a fallacy. That is not true. If you're in a care home, whether that be a nursing care home or just a residential home, you have a right to access universal services. Lack of continuity of care and the difficulties faced by the current workforce crisis. It keeps rearing its ugly head. In the vanguards, they realised that workforce was a big issue that needed to be addressed. Financial barriers are that actually the money that used to be made in care homes isn't made like that now. And if you're not paying enough for care, so if the CCGs aren't paying enough in fees for care, then actually quality will be cut as a consequence. The national living wage was a biggie. I mean, I'm an advocate of the national living wage. I think everybody should have a minimum wage. Absolutely right. But whether we like it or not, the care home providers had to find that extra money. Nobody suddenly upped the fees and gave them more money to deal with the bigger cost of their staff. The Enhancing Health and Care Home framework recognised all of those barriers and decided that the framework would apply to self-funders as well as those that are funded by the NHS or the local authority. And there were 7 principles, 7 care elements about better primary care support for those in a care home, better multidisciplinary team support, more reablement and rehabilitation, better end-of-life care and dementia care, joined up commissioning between health and social care. So if you're going to commission a care home, commission it together. Workforce development, here today, data and IT technology. So pull this plan out and have a look. And what a good idea to map your care home against it and say, let's have a look. This is what they say are the best care principles. How are we doing when we measure ourselves against those? So the aim was obviously better care in care homes, but also that those who choose not to go into a care home and live independently have that right and can be supported to do that too. And also the best use of resources. It's much cheaper to keep somebody at home in a care home with the right package than it is to send them into hospital to get their care. So So we're all encouraged to adopt this framework. Like I say, go and have a look. Some of you will be delivering some of the framework, and if you are, that's great. Add some more bits in, do even more. Or if you're doing some bits and not the other, just concentrate on the bits you're not doing. The CCG, and I can see Louise is in the room at the back, the Deputy Director of Nursing, they've already mapped their CCG against where they think they're at. And they're going to redo it because we've moved on a bit and get another baseline, and there's a whole team of people who are working together for the benefit of North Cumbria. We've augmented it, so the plan says nothing about the red bag that you see on the agenda today or the reactor aid trusted assessor. So we've augmented it, we've added those bits in because it's considered to be good practice. And the Care Home Collaborative that Louise chairs in North Cumbria has, I've only put a few of the representatives on there, has people from all over, people who are interested in care homes, all sitting round a table to try and make sure that we can roll out initiatives and make you aware of initiatives that make care for the patient resident better. Just a group of committed people working together to deliver something of quality to those we serve. And I make no bones of that, because I certainly think every one of us in here is serving the population in which we work, because we'll be there one day, some of us sooner than others. So I'm really committed to this work. I really am committed to this work, and I'm going to tell you why. These are my parents, who I love dearly. Him on the left, your left, that's Eddie. He's 87. And on the right, that's Isabel, 82. Been married more than 60 years. Eddie's just been diagnosed with Alzheimer's. And on the back of that, a terminal kidney cancer, because it's spread to his lungs. I don't know how long we'll be able to keep him at home. He's very possibly going to need care. He's certainly going to need end-of-life care. Can I just say, and honestly, I'm not going to apologise, I am a care home's worst nightmare if my parents go in your home. And you need to think that for every person that comes in your home. And you'd be the same if it was your parents. I will fight for the best. I expect the best. They deserve the best. As my dad in his dementia keeps telling people, I fought for you in the war. He didn't. He was 15 when the war ended, but it makes a good sentence, and he keeps telling everybody. So our challenge in here today is to work together to help people to live the lives they want, not what we want. So they might be in your care home, but guess what? They don't have to live the same life. So the fact that you think take breakfast ready at 8:30, if Johnny wants his at 10:30, then Johnny should get his at 10:30. It's not about them fitting in with the care home. It's about the care home fitting in with them. Delivering high quality care to people wherever they live. Care home, home, sheltered accommodation, supported living, doesn't matter. Let's just work together to give them the best care we can, because like I say, we'll be there one day. Thank you so much for listening. Ken, I have no idea how you're going to make the time up, but that's really not my problem.